Dr. Jayne Morgan is the Executive Director of the Piedmont Healthcare COVID Task Force. She joins me now, and thanks for doing so, Doctor. Now with this sort of pill to come, I mean, do you see it as a potentially useful tool in the toolbox, or a potential game changer in terms of COVID treatment?
Absolutely, Michael. This is a tool in our armamentarium, and we certainly are welcoming this tool as we look at patients who can have breakthrough infections, or unfortunately the unvaccinated who also may become infected. This is an opportunity to keep people out of the hospital and certainly out of the morgue.
It's promising. Is there a risk, though, that this and other treatments, which might be on the way as well, could disincentivize the unvaccinated to, stay unvaccinated and just say, well, I'll take a pill if I get sick? And if so, what impact might that have on overall virus control were that to happen?
Well, I certainly hope not. And I hope that we can certainly get ahead of this messaging, because this will not be the first pill to come. We have Pfizer, we have Atea, we have a plethora of other companies making all types of medical therapeutics. But don't forget, they are not prevention. And like your grandmother used to tell you, an ounce of prevention is worth a pound of cure. You do not want to get infected. You do not want to have exposure to this virus and risk being sick and then having to take a medication or therapeutic to contain a virus that is already inside of you.
Yeah, because I guess if you're unvaccinated and you're going to rely on the pill, the horse is bolted in many ways. There are studies underway too, evaluating whether antivirals can prevent infection after exposure. Do we know if this drug might prevent transmission, or is it too early to tell?
So we don't have all of the data, and don't forget, what we have seen is an interim analysis, so not all of the data. And so what we know is that there has been a 50% reduction when they look at the control group versus the group that actually got the pill with regard to death and hospitalizations. In fact, there were no deaths in the group that received the pill, and all the deaths occurred in those who had not received the pills at about a 50% rate. This was not an incredibly large phase 3 study, as phase 3 trials go, just over 750 patients, but very promising data. And I think it's the first of many therapeutics to come to market as we continue to battle this pandemic.
Yeah. I wanted to ask you too, more broadly, pills aside, I mean, politics are still clearly in play in this pandemic. Johns Hopkins University data showing that deaths from COVID in non-metropolitan areas are happening at more than twice the rate of deaths in metropolitan areas. How concerning is it to you as a healthcare professional that continued political divide exists?
You know, Michael, it is so concerning and so distressing, because not only as we are in this fourth surge of the pandemic, this is the first surge that we have had that has been entirely preventable because we've had vaccines readily available and accessible. It is also the first surge that has been driven largely by misinformation. And so this is incredibly, incredibly distressing and disturbing, and we want to combat it directly at all costs and whenever we can. We want people to follow correct information and come out of those social media rabbit holes.
And real quick, we only got a minute left, but I wanted to ask you that there are also signs that parents seem to be a little ambivalent about vaccinating their kids. There was a Kaiser Family Foundation study that found only 27% of parents of 5 to 11-year-olds say they will definitely vaccinate their child when a vaccine becomes available for that age group. Are you worried about that, or are you confident those numbers will improve over time?
We do not want to set this tragedy upon our children, even though by and large they do better. When exposed, we are beginning to see long-term effects of this virus on children as well. Hallucinations, seizures, GI complaints. These are things that not only can cause absenteeism in school, but also, if you are present in school, can decrease your success rate because they interfere with learning. So we absolutely want to prevent infection with this virus whenever we can with vaccines.
Dr. Jayne Morgan, you've got to leave it there. Thank you so much.